So buccal fat pad removal or buccal fat pad reduction is a procedure to remove a portion of the buccal fat, which is right here in the anterior or the front cheeks, used to help contour the face. It gives people a little bit more shape, a little bit more contour, and look more lean in the face. The buccal fat pad is actually an extension of a large piece of fat that goes all the way from your temples down your face and into the side of your cheek, but the only part that's removed is the very front end of it. The fat is usually accessed through an incision in the inside of the mouth. The incision is usually just about a little bit centimeter. So it's almost like going to the dentist with a little small cut on the inside of the mouth. The fat is removed and then the cut is closed with stitches. Usually this procedure can be done while the patient's awake, and the procedure is very quick. It usually takes less than an hour to do both sides, and the recovery is also quick as well. You might just expect a little bit of swelling, a little bit discomfort of the face. It's like getting some dental work done. You may feel a little bit tenderness and swollen. And for the first few days, you're gonna start with a cool liquid diet, and then you're gonna advance to more solid foods and probably stay away from something salty or something sharp like potato chips for about a week. After about 3 to 4 weeks, a lot of the swelling is gone, and then by 3 to 6 months, you're gonna have your permanent results. Now, buccal fat pad reduction is not for everybody. If you are already starting out very lean, or you tend to have the genetics where people in your family get even leaner or skinnier as you get older, you may not wanna do buccal fat pad removal, because if you get too skinny in the cheek area, it may make you look older. You may have a little bit of sagging skin, and it can also go as far extreme as making you look sick. It's also an area where when you remove the fat, it's very difficult to restore the volume. So you're not going to be able to put fat back into that area directly. You can try to use fillers, but even that may not look very natural. So the best candidate for buccal fat pad reduction is somebody who tends to carry a lot of weight in the cheeks, and even with a lot of diet and exercise, when the rest of your body's lean, you still tend to have a round, full face, especially the lower face. You can also look to people in your family as they get older, whether they also continue to stay full. If that's the case, then you're probably a better candidate to get buccal fat pad reduction with very low risk of complications in the future.